If the data shows that the virus is spreading at a high rate, we won't hesitate to take action to protect the people of Illinois. Your health and safety is my paramount consideration. How each region is doing is available every day on the IDPH website. But I want to highlight that what's going on across the state, that over the last 2 weeks, 9 of our 11 regions in Illinois have continued to see their positivity rates creep upward, with 4 seeing more than 1 full percentage point increase in positivity rate. Only 2 regions have seen an actual reduction in that same period. That's the West Central region, that's Region 3, which stretches from Quincy across to Springfield, and the East Central Region 6, home to Urbana-Champaign, to Decatur and Effingham. We continue to closely monitor every region. So I want to emphasize again that local elected officials and health officials should pay close attention to the data for their communities and, where necessary, step up and impose greater mitigations on a targeted basis to bring down the number of infections and the positivity rate. It's time to mask up, Illinois. If we all do our parts, masks, distance, hand washing, getting tested, we can get through this and we can come out stronger on the other side. Lastly, I'd like to invite all Illinoisans to join me and multiple faith leaders in a virtual memorial service tomorrow night that honors those who have lost their lives to COVID-19. You'll be able to tune in to our live stream on social media starting at around 6:30 p.m. and I'd be honored to have you join us. So thank you, and with that, I'd like to turn it over to Dr. Amal Tokars, Assistant Director at IDPH, for today's medical update.
Thank you kindly, Governor Pritzker. I'm going to say just a few words that will affirm what the governor has just said to you. As we talk about COVID-19 in Illinois, about the outbreaks, positivity rates, and regions heading in a worrisome direction, please remember that what we are ultimately talking about is people. Public health's entire goal is to help people and prevent people from becoming ill, being hospitalized, placed on a ventilator, getting seriously ill, and even dying. Everything we do is to help protect the health of families, friends, and loved ones from COVID-19. When we start talking about mitigation efforts and what cities, counties, businesses, health officials, and others should be doing, which is all critical and has to be done, we can readily lose sight of why we are doing these things. It is to protect people from a potentially dangerous and even deadly disease. And we have started seeing the number of people with COVID-19 increase, as the governor has just stated. Today we are reporting 2,128 newly diagnosed with COVID-19 and 27 people with COVID-19 who have just passed. This brings the total number of individuals in Illinois to 238,643 and a total number of lives lost of 8,091. The Illinois Department of Public Health is reporting today approximately 32,751 COVID tests. While all results have been reported out to those tested, we are experiencing a minor tech issue in the data processing system that we use to report out tests publicly. And that is why this number is somewhat lower than the 40 and 50,000 tests we've been reporting previously. This is being worked on with urgency, and we expect that this will be addressed very soon. Now, I want to say something in closing to you about the upcoming holiday weekend. There are persons all over the state of Illinois that are dedicated to the service of public health in every county across the state. Listen to them, help others, and as we gather, we know, as the governor just stated, that the hand washing, the masking up, and the social distancing are very necessary. And so even our small, intimate family gatherings must look different than they did before, but can be every bit as rewarding, as important, and as enjoyable. So help us help one another, and let us make sure that when we are in social gatherings that are not too large, especially if they are small gatherings indoors, that we are also remembering to infuse these principles of hand washing, masking up, and social distancing. Thank you so much for your time. And I want to introduce our good colleague, Dr. Bleasdale.
I want to thank the governor for having me here to comment. And I want to thank the governor and the Illinois Department of Public Health for their leadership, as they have done so many measures to help to protect the people of Illinois in decreasing the spread of the COVID-19 infection. I'm an infectious disease physician and a scientist, and I have cared for COVID patients. We have science that shows that face coverings and physical distance can slow the transmission of this infection. Illinois was one of the first states to implement the requirement for face coverings. And this helped slow the spread of the infection and allowed hospitals like mine, UI Health, to be able to care for all of our patients, not just COVID patients. And we've been able to resume normal activities because of the work of the Department of Public Health and the governor. We've seen some of our neighboring states that were slow to adopt this measure of face coverings, and they have not been able to slow the spread of the infection to the same degree here in Illinois. We do know that there are certain activities that are at high risk for transmission of the COVID-19 infection. In particular, these are activities that don't allow for physical distancing or masking. These are activities of eating together and socially drinking together. In particular, in certain settings where you are bringing together a large number of people in restaurants, bars, or large gatherings, this is an opportunity for transmission at a vulnerable time when people have their masks down. In addition, if you have a community with high levels of positivity, meaning there are many people that are infected, there are probably many people that don't know that they're infected, this increases the number of people that will be at an event or at a restaurant or at a bar that will likely be infected, and then increases the number that can secondarily be infected, and then can lead to ongoing positivity within that community. Minimizing the number of individuals in a setting, requiring them to be seated, will not completely decrease transmission of the COVID-19 infection, because there is still risk. However, minimizing those numbers will decrease the number of people that are exposed. When you dine with someone you know, there is still risk. However, when you dine in a large setting with multiple people you don't know, this can also present further challenges for us and for the Department of Public Health. Because contact tracing for a group of people that you don't know who you were in contact with can create a delay in the notification of a potential exposure, and someone could develop symptoms and then have secondary transmission beyond that. Decreasing density, because there are many unknown contacts, can help us to mitigate the transmission. And again, many people think that dining or gathering with people they know, as many people may be considering for this holiday weekend, it does not decrease the risk. The mitigation strategies that the Department of Public Health and the governor are putting in place will help to decrease some transmission within communities of high activity, but it's something that we all need to continue to work on, and what we've done. You need to make sure that you're wearing a mask, even with people you know, because they're outside of your household, and it is an opportunity for transmission. Maintain that distance, maintain your face coverings. These measures are not insignificant. Dining and social drinking and gathering are part of our culture and much needed activities as we have been isolated for much of 2020 during this pandemic. These have been necessary requirements, and right now, when there is areas of higher activity, we will see increased hospitalizations, and then secondarily, we see increased deaths, as we've seen in the other states, as the governor has mentioned. It's important for us to use these tools to target at-risk communities to preserve our hospital capacity and to protect those that are vulnerable for complications from the infection. This is temporary, and with measured metrics, much like we had to move along the phases to phase 4 and phase 3, these are measured metrics that will help us to eventually open back up in certain areas as there is decreased transmission within a community. This, partnered with testing, can be very effective. We may see somewhat of a seesaw back and forth of opening activities and closing activities, but this is really important until we get an effective vaccine and treatment. At UI Health, we have been part of trials for treatment and started trials for vaccine, but we're not there yet. We don't have an effective vaccine or treatment to help to control the spread, and so these other measures are vitally important.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.